But first, the latest on a Kate Middleton. And according to royal insiders, Kate was actually inspired by King Charles to reveal her cancer diagnosis in a video, of course, posted back on Friday. And much like the king, she is receiving care, great warmth and affection, including a heartfelt message from an 8-year-old former cancer patient. Her name is Amelia Snedden, who previously met and developed a relationship with the Princess of Wales while diagnosed with leukemia back in 2021. She has voiced her support for Kate, telling the Daily Mirror, quote, "She will be brave because I was, and she will fight it like I did."
And so many people are sending Kate messages like this, saying, thank you for being so open. Thank you for sharing your story. It helps all of us deal with our own battle and for preventative reasons as well. Actually, for more on this, on Kate's cancer diagnosis, we've asked one of our in-house doctors, Dr. Iris Gorfinkel, to join us now. Dr. Gorfinkel, it was originally announced that Kate's condition was non-cancerous. However, after the abdominal surgery back in January, tests found cancer had been present. How rare is that?
Actually, it's pretty rare. Most of the time, it's going to be benign when we go in. And the reason is just the pure numbers favor that. So consider ovarian cancer. Now, that's a cancer we don't have a test that can predict, right? So there's no MRI, ultrasound, or blood test, even when you put all those together, that can predict that cancer. Bad lottery. The risk of that is around 1 in 3,300 people. So that's why, we don't want to scare everybody. We can't do that, so you go in, and if you discover it, it's hard. It's really tough. My heart goes out to her. We do not know the type of cancer that she has, to be fair. It could be any intra-abdominal cancer.
Okay, what we do know, though, Dr. Gorfinkel, in the video, Kate says her treatment involves a course of preventative chemotherapy. What exactly is that?
Well, this is the thing. When a surgeon goes in to remove a solid tumor, we cannot be sure that every last cell has been taken away. So what is a cancerous cell? A cell that's dividing without control. So one cannot see cells with the naked eye. So the idea is give chemotherapy afterward to knock off those cancerous cells that could have, by mistaken, be left behind. So that's the concept of that extra chemotherapy. And she said, out of abundance of caution, that's why they're doing that. Of course, we do not know the type of cancer she has.
Okay. So the royal family is now dealing with multiple health crises. But now both of them, both the King and the Princess of Wales, are being open and transparent about what they are dealing with. When it comes to cancer prevention and reminding us about the need for regular screening, as a doctor, how pleased, how happy are you that they are pulling back their curtains to let people know what's going on?
I think they've struck a beautiful balance between pulling back the curtain and at the same time asking for time. Did you hear what she said? I need time. I need space. I need privacy. And I think the experience of illness is that way. Those are the things we need. And in a way, it holds up a mirror to our own mortality. No, the gig doesn't go on forever. Yes, we do have to value the time we have. And there are cancers we can screen for in advance, cancers that actually, if they're caught early, will be curative. Cervical cancer, breast cancer falls into that category. So does colorectal cancer potentially, and even lung cancer.
All right, Dr. Gorfinkel, really appreciate you being with us this morning. Thanks so much for this.